Welcome to Getting to Know You. It's getting to be the end of the year, so it's time to take a little stock and to say some thank yous. And we can't think of a better person to basically tell that to, thank you, and taking stock, but also to express the gratitude that all of us have had in participating in an amazing year, if you haven't already figured that out. So I'm here with Dawn LeBoeuf, and her title, she wears it every day, clinic coordinator. But I think most people just feel like Dawn solves all the problems that we have when it comes to our health. But this is a special year, Dawn, because as I thought of, you should have an accounting. You look at the end of the year and say profit and loss and so on. And it's been hard to do that because we treat so many different people in so many different ways and answer so many questions in the clinic. But this year, there are numbers. And I thought of that as I looked at my vaccination card. I don't even have my booster on there or my flu shot. And I said to myself, here is a person who has done 4 times for practically every person in Stonebridge this kind of a little record. That's like 12,000 shots. No, 1,200 shots, right?
Yeah, this really is an extraordinary year. We've never had such sort of mass vaccination or attempts at really, increasing people's protection on this scale.
Preventive healthcare.
It really is. So normally we have one day, one flu clinic, and we try and encourage as many people. This year, we had multiple days, multiple clinics for multiple different vaccination series.
Right.
It was really extensive, and in addition to the resident clinics, we also did a lot of employee vaccinations
I didn't even
as well.
count those. And
it was really extraordinary.
And then the tests, the positive or negative tests, right? How many of those did you do?
Yeah, so what's incredible is that currently in the clinic I have 7,000 rapid tests available. For any resident or staff member that might be experiencing any symptoms at all, we are trying to be as aggressive as possible in really making sure that we test early, test often, because that's the most powerful weapon we have in really distinguishing between, is it an allergy, a cold, a bacterial infection, or the virus? That's been the question this year.
Right, and then you have to keep all of these records for the regular shots, and as you say, then take care of people who even do get COVID. That's another.
And the record keeping has been really an extremely important piece, because residents requiring any kind of medical care cannot, in some cases, receive it without proof of their vaccinations or their testing. So thankfully, one of the resources we were able to get access to was the New Jersey immunization system. Now I have a much better access tool to make sure that we catch all the vaccination records. But before then, it was all manual. So, it's been tricky. But the exciting thing about this process through the year was that we have 100% of our independent living residents fully vaccinated against COVID, and we have about 95 to 96% with their booster shot. We have approximately 97% of our independent living residents this year vaccinated against the flu as well.
Right. That is an incredible record, and we want to thank you. And it wasn't really obvious who was there behind it all to make it happen. And I do want to, as I say, thank you on behalf of all of us that we've gotten through this year. It really is quite dramatic. And
it really is, and the difference now from where we were even last December, before those first vaccines became available to us, we did have a number of COVID cases, very small ones. But the processes, the protocols in place have improved so dramatically that even when we have to test and isolate and worry about this virus spreading, we are much better, in a much safer position to provide timely and effective care, because we've learned not only strategies but also medical, whether it's a physician's order, a medication, oxygen, or different things to check, because the virus symptoms have changed
Right.
a lot over the years. So what we were looking at initially back in, March of 2020 is not at all what we're looking at today. So learning about this disease and staying very informed about the changes has been really important. And actually New Jersey Department of Health, and specifically Montgomery Township Department of Health, have been absolutely superb at helping us get access to the information we need to make the best safe infection control decisions we can.
Right. And I think another factor that we've forgotten is, first of all, when we started this year, there was really a lot of concern, frightening frightening atmosphere, because we just didn't know. And then when the vaccine was announced, many of our friends who aren't here at Stonebridge had a lot of trouble getting vaccinated, didn't know where to go, couldn't get on the website and so on. And here at Stonebridge, it was announced and we all showed up, and that anxiety was eliminated as well, which I think was really playing out to great detriment, as people were concerned, where would they get it, would they ever get it?
It's amazing to look back when now you could walk into any pharmacy or even supermarket now and have easy access to vaccinations, in some case without an appointment. It's easy to forget that back in January of 21 of this year, which is only 9-10 months ago, that was a very, very different situation. And the access to the vaccine that now has enabled us to, in essence, restart so much of our social lives and our safe movement around the community and outside.
Just have this card handy.
Yeah, that's right. The card is, I said, whenever I gave it out, I said, guard it with your life.
Who would have known?
I know. So take a picture of it, share it with your loved ones, your children, make sure everyone has one. But it really, and the nice thing is, I have a copy of any vaccination done in the building. We do have easy access to print you a copy. So please never, be concerned if you don't find that piece of paper. It's okay. We always have access to it.
Right.
Yeah.
And as they say, meanwhile, back at the ranch, you and your team were taking care of everybody here at the same time. And I thought maybe you just want to say a little something about your team, because not everybody knows who is there in your offices and here at night and so on. So could you tell us just how many people and basically what they do?
No, absolutely.
Or the clinic making it possible for all of this to happen.
It's always interesting. I always say we're sort of small but mighty, the team. So there's 10 members in your clinic medical community staff, 4 full-time nurses, 4 aides, 1 administrative assistant. Bernice had been our long-term administrative assistant. And we were so fortunate that Miley, who was the healthcare assistant, was able to join us. I'm absolutely thrilled because she's fantastic. And then myself, so 10 people in total. Our team works from 7 in the morning until 10 at night every day. And overnight we have, of course, our medical care, emergency care from skilled nursing. Our nurses and aides have some of the most longevity in the community, and I think that's a really important part.
They know a lot of people.
They do, and what people, I don't know that people think of when they think of independent living nursing is these nurses need to have excellent critical thinking skills, really able to prioritize multiple medical emergencies simultaneously. We're looking at multiple different facets. So community care, whether it's an illness, an injury, a medical emergency, assisting the physicians, regular follow-up for any consults or medications people need, and taking care of our employees.
And all the records.
Yeah, all the records, everything we need to try and find continuity of care, right? So everything about the needs of our residents should work seamlessly together. Our ability to give consistent information to all your members of your medical team so that when you go to your pulmonologist, they have access to all the information they need from the cardiology team and so on.
And then there's the day-to-day, sitting in a chair. If it wasn't so noisy out there, we would have been doing this program, so you'd have a chance to sit in the chair for once.
No, it's
day-to-day appointments.
It's a very busy clinic. So of the Spring Point communities, Stonebridge has probably the busiest clinic in terms of services that we provide. Physicians services, we have our 3 doctors that come from the Pecora group. Dr. Pecora is our medical director. His team are here 3 or 4 days a week. But we also have about 7 or 8 other specialists that provide really, very important services.
In the weekly bulletin,
yeah,
so
we do
know.
lab work and radiologic tests, COVID testing. A lot of medical resources provided through the clinic services just on the Monday through Friday. And the aides themselves provide aid services to residents in the community as well. So the 4 clinic aides move around the building, moving from resident to resident, providing really important services that allow people, in many cases, to live alone, still with some support, whether it be shower assistance only, for laundry assistance only, or some combination of really extensive assistance. It's really amazing. And we grew from, I think it was 3 half days a week to the clinic program that we have today. So we definitely have a wide range of services, and we are fortunate because the nurses here have gotten to know many of our residents, and for our new residents, they will get to know them. And that makes a big difference too.
It's a real effort to do outreach. Well, we'd like to know a little bit more about you, Dawn. And I know you're a mother, and this is very brief, because we've met your daughter in the dining room. Not only does she serve well, but I had a conversation with the people at my table, and we were talking about the Constitution and how the first article was about redistricting. And she was so proud. She said, I know about that. We just learned about that in school. I'm going to tell my teacher. It was just a wonderful scene. You can be very proud of her. So what else should we know about you? How did you get to be a nurse?
So it was really quite a roundabout journey. So obviously I was educated in England, and then after I graduated university, actually originally with a history degree, I came over to work for the Walt Disney Company. From there I moved actually to become an investment trader. So that was my first career, and I had a full career of 12 years as an investment trader. I did that for many years. Stocks, bonds, options, on a regular desk.
We'll remember that.
So it was, and I enjoyed it, but really, interestingly enough, it was the birth of my children that really changed, my trajectory and my real passion. So I have twin girls. They're both 17, although I feel like they're still about 5, in my head. But they don't feel the same way. So one of my children is Elizabeth. So she's currently a high school senior. She's absolutely obsessed with music.
Really?
My husband is a musician.
I was
He
going to
travels
say,
extensively.
Some genes in the family there.
So that's her passion, and so that's what she's working towards. So college, we're definitely looking at music programs. My other daughter has a very rare genetic disorder. So she has a very different journey than Elizabeth. But she's absolutely amazing. They really did not know what her future would look like. But she's doing very well. I mean, she really, she doesn't speak very much, but she sings beautifully.
Oh, another musician.
And she's very clear in what she wants and doesn't want. So it's the 2 girls and myself. And then I'm fortunate because while my family still live in England, they're able to visit. With the exception of recently, they generally spend a lot of time with us.
That's great. So, how did you get to be a nurse?
So I was originally really focused on pediatric nursing, and that was largely a result of my daughter Lauren being born with very rare medical conditions. She had multiple kidneys. She was born with no hip sockets. She had a lot of very complex medical needs. So we spent months on end at the Ronald McDonald House. She had 8 surgeries in a year.
We should remember that. That's
a good cause. The Ronald McDonald House is an extraordinary support for families like ours who we spent months on end at the hospital. And interestingly enough, I had spoken, to our different surgeons, and I said, I really think I'm going to change careers and go into nursing. And the surgeon at the time said, you'd be shocked at how many parents of special needs children, find that their passion leads them in that direction. And largely, I'm sure, because of the medical needs initially. Then as I, learned more and trained in nursing, I actually gravitated towards geriatric nursing originally. I worked extensively in skilled nursing, and then this was my first real change into independent living nursing. So the interesting thing was, skilled nursing is usually you really only learn a very small piece, right, of someone's journey. So maybe 6 weeks, and then a resident is moving on to the next, back to home or something. Whereas this, I actually really enjoy a lot more, because we do get to see, residents over really, they're in their homes, and, get the privilege of caring for them over a long period of time. And I think that really leads itself to better care.
Right.
But no, I love it. Absolutely
and you
love
came
it.
to Stonebridge when?
Yeah, September 2015. Yeah, so that's 6 years.
You really
now.
knew when we moved in.
That's
I didn't realize
right.
that. I thought you knew everything, and you were in here all the time. That was.
Yeah, well, a lot has changed since 2015. I feel like we've been through a lot, but it really has been an extremely rewarding and interesting, time frame to be in nursing. The whole concept of what we provide, the medical needs of some of our residents moving in, the function of the clinic, and my vision of what the clinic should provide has definitely, grown over the years.
Well, we want to thank you for all of your years, but particularly for this year and the numbers that have piled up, that we can say we know exactly what Dawn did this year. And we hope maybe it won't be that way next year. There'll be other challenges and some other good surprises, I guess. And we're so glad that we can say we hope you have very happy holidays, and we look forward to another year with you. Thank you for all you do.
Oh, thank you, and thank you for the opportunity to speak and meet with you today. It was an absolute pleasure, and I absolutely love it. And the clinic team we love what we do, and we want to help people.
Right. Well, if maybe we can even get a team picture at some point, so we can have that in our file.
Absolutely.
Okay.
Absolutely.
We'll arrange that with you. So thank you for tuning in and beginning to think about what we should be thankful for this year, and looking forward to another good year that we know will be happy and healthy with some guidance from Dawn. So thanks a lot.